the focus is really on first, like, awareness and education. I think everyone needs to know that climate change has direct and indirect impacts on our physical and mental health, and those impacts are not equal for everyone. So, for example, you're based in the US, like communities of color in the US are going to be the ones disproportionately suffering from environmental racism, from lack of tree cover in their street, which means that the concrete is super hot and stresses you out even more. And the hotter you are, there's an association with like an increase in like violence and bad mood and things like that. So I think the first thing to know is that climate change affects all of our health, but in different ways, and different groups have, ultimately it's a question of money that provides a buffer for now.
Welcome to Public Health Careers. I'm your host, Omari Richards, founder of the Public Health Millennial. We're going to dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies, get tips, while also learning from others to help you in your own journey and learning of public health. Learn about the vast world of public health careers, or just hear public health stories. Stay tuned so we can do our part towards a culture of health, well-being, and equity for all. Hey friends, welcome to Public Health Careers. In today's episode, you'll hear more about the important and under-discussed topic of climate mental health. It's really thinking about climate change and what impact that has on our mental health. Why this person decided to shift away from health marketing and wanted to pursue and learn more about the intersections of public health, climate change, and mental health, as well as learning more about the public health perspective from a Gen Zer living and working in Europe, advocating for better climate mental health solutions. If you enjoyed today's episode or any other episodes, all I ask is that you hit that subscribe button, leave a review, and share this with someone who gets some value with it. This really is the best way to support public health careers and the Public Health Millennial, get out to more people. So be sure to subscribe, leave a review, and share it with someone. It might really help someone else navigate and transform their public health career. So be sure to do that. I thank you so much for that. Okay, now enjoy the show.
I'm Georgia Welford-Tuitt, and I'm a Gen Zer who's interested in the impact of climate change on mental health. You're listening to Public Health Careers.
Today, we have someone passionate about issues pertaining to health and climate policy, financing, the gender gap, and addressing social and economic exclusion in healthcare. She got a Bachelors of Science in Anthropology at the University College London, then worked for a bit before getting her Masters of Public Health at the French School of Public Health. She currently works as a Gen Z advisor at the Climate Mental Health Network. We have Georgia Welford-Tuitt, MPH. Welcome to the show.
Thank you for having me. I'm super excited to be having this conversation. As I said before, I've listened to so many episodes of this show, so it's a bit weird to be on the other side.
Yeah, I heard that many times, and I'm excited to have you on. You have a very unique perspective, and I'm glad that we're able to connect on LinkedIn and now get you on the show to share more about your experiences.
Thanks.
So tell us, how do you identify, as well as share a little bit about your background?
Sure. So I identify as a cis woman. My pronouns are she, her, hers, and I'm English. I have two grandparents who are actually from the West Indies, and two who are from England. And so therefore I'm kind of mixed race, and I grew up in a very diverse suburban area, just not too far from London in England. And yeah, I kind of lived most of my life in or around London until I went to Sciences Po for my Erasmus in 2015. So I moved to France for a year, and I came back to London to finish my studies. I started working in London, and I really missed living in France. So I ended up coming back a couple of years ago.
Okay, well, thank you for sharing that, as well as I don't think I said thank you for listening to the podcast, but thank you for listening to the podcast. I appreciate that, and appreciate you sharing a little bit about your background. What was it about France that made you want to go back?
I guess the short answer would be quality of life, which I guess is people interested in global health. That's a pretty big thing that we're all conscious of. So, as a lot of you will know, the UK recently left the European Union, and that had a huge effect on us financially. And there's been some kind of big political changes leaning towards a more conservative, right-wing social and fiscal policies in the past 3 years since I started my undergrad all the way back in 2013. So there's a kind of cost of living situation crisis, which has been building for a while, and kind of a lot of political things I don't necessarily agree with. So whilst France isn't a utopia, it does have a lot of great socialist policies that really do trickle down and you see the impact on your everyday life. And I'm not the only person from my friendship group who ended up moving back after spending an Erasmus year here. I don't know if that's a really common thing with people who study abroad. I don't know if it's, I would love to know the stats on how many people end up going back to that place. But yeah, it's just a really lovely place to live. And I'm in Paris, so there's a lot of culture and a lot of science and some really interesting conversations happening about climate change right now and adaptation and how can the city kind of stand up against the challenges of climate change.
Awesome, and that goes into the next question. So you're a Gen Z expert, I would say, on climate mental health. So I know we're going to talk more about this later on in your journey, and because this is a big theme of a lot of your career so far. But I just wanted you to share more about climate mental health from your perspective.
Yeah, so it's actually a relatively new topic to me, and part of what makes it so exciting is that it's such an emerging field of research. I was lucky to be the president of a student association whilst I was doing my master's. And the association kind of works like a model UN event. I don't know if you're familiar with model UN.
Yes.
I think it's a very American thing, right? Yeah.
Yes.
So it's like that, but for the World Health Organization. So we organize a mock World Health Assembly. And because this was right in the middle of COVID, we had to do it online, which opened up the possibility for so many more people to attend for a much lower cost as well, which was great. So yeah, I was in charge of organizing this model WHO activity, kind of like a networking and an educational activity, learn how to write and share policy. So of course we had to come up with a theme of, okay, what are all these policies going to be about? And we floated the idea of climate change and mental health, and we kind of thought, oh, that's weird. We've been studying public health for nearly a year now, and we don't really cover that much about mental health, and climate change isn't coming into our curriculum in a way that feels proportionate as to how much we're all thinking about it and worrying about it. So kind of organizing this event for students was just a really big awakening and radicalization. And I got to meet a lot of, experts and keynote speakers who were really kindly giving up their time to speak to my students, and just it flew from there. It just became like a major passion after hosting that event.
That sounds amazing, and yeah, I think Model UN, because if I remember correctly, because I'm from Trinidad originally, my sister
Yes.
did it while she was in Trinidad, I believe. So maybe it's like a Western world type of thing, but that sounds like an awesome experience, and I could only imagine just how much maybe traction you'll have gotten because it was virtual, because of the pandemic. Granted, all of the bad things that came from the pandemic, I think like that's one
Yeah.
of the benefits of it. Did you want to add something to that?
Yeah, it really made a huge difference. the previous cohorts who were organizing the previous year's events, you know, people were having to apply for visas to come to France and prove, you know, that they had X amount of money in their bank account and find accommodation and turn up to this place just outside Paris for 3 days in a row. So, you know, it's a lot of logistics and money to organize an event and also to attend as a guest. It really is it is actually a big commitment, especially with Model UN and things like that. People are writing policy papers and researching their roles in their countries. So I think the kind of online nature was the one online thing I was grateful for during that period. And it was a big plus because a lot of us were feeling pretty isolated studying online during a pandemic. So in my case, it was I was studying in English, but in France. So my course was kind of targeted at international students who are looking to live in Paris to study. So that means that, you know, we have people coming from Thailand, from Russia, from Greece, moving to a new country for the first time, and they're completing a 2-year degree essentially on Zoom. So that can be like a huge waste of money and a lot of isolation from, you know, your friends and your family who you already love. So it's, on the one hand, it's unfortunate that it had to be online because of the context, but on the other hand, it provided like a much needed like networking opportunity for everyone who'd really just been like stuck in their bedrooms for the whole year. So yeah, I'm really glad that it was able to happen, and we were able to offer scholarships and things like that for students from, you know, difficult contexts to be able to join as well. So I feel like a lot of barriers were kind of lifted by it being online.
And that's exactly what I was going to say. Is like, as you name those barriers of having to have a visa, having to have a certain amount of money in your bank account, which is something that I think a lot of people don't realize when you're traveling, especially for like
passport
school
privilege.
Right. And it definitely is something that we don't think about enough, especially, I guess, from the US perspective. Granted, not many people in the US have, not a majority of people in the US have traveled internationally, but it does come into context whether you're in the US or in Europe or anywhere else. Just what are those barriers that do come up because you aren't able to afford it, or whatever the case might be, and just how the digital life has given us a way to reduce those barriers and give people the opportunity to take part in these types of events and conversations that wouldn't been able to before. So that is definitely an awesome highlight.
Yeah, I'm very proud.
Awesome. Well, we'll probably come back to this topic of climate mental health a little bit later on when we get to dig more into it. And before we jump into your undergrad story, I would like to ask, what does public health mean to you?
Oh God, I find it so hard to. I mean, coming from something as kind of niche as anthropology, you would think that I would be a bit more appreciative of how public health seems a bit more concrete and relevant to the everyday person. But I still find it difficult to kind of articulate myself and distill what it is, because I had the chance to really have I had 2 years of this master's, and we got to dabble in everything from like epidemiology, data analysis, to environmental and occupational health, but also kind of more sociology type of things like quantitative and qualitative research and designing programs. So to me, when I think of public health, I'm just like, oh my God, it was that enormous blob of 2 years where every other week I was doing something different, and I wasn't feeling very good at much of it. And then it would change the next week anyway. But I guess what I just say is it's the infrastructure and the systems and the policies and rules that kind of dictate how your health will be treated as a community. I think it's easier when you kind of try and distill it and apply it to how it works for the individual, but I think people kind of easily get a bit confused, and you have to explain, no, I don't actually know how to do medicine. But a lot of people who know how to do medicine end up studying public health in one capacity or another.
Absolutely, and yeah, that is too true. Public health is very broad. It can be hard to share and let people understand what is happening or like how this even works, because many of us in public health, it took us quite a while to get into public health and to understand what public health is and how we can make this like a career and do work in it, because it's not something that I feel like we spoke about enough. Maybe more so now because the pandemic happened. It has created more of those conversations on a global scale that people understand, oh, there's this public health thing that's kind of important, and we need smart and bright people in these types of fields as well.
Yeah, I think the COVID pandemic has done a lot for kind of raising awareness of the importance of public health and kind of the consequences of withdrawing funding or what well-funded public health looks like. And I think it's there's also this other cynical side to it, right? Where a lot of the contracts and internships were very short term. So when I was starting to study, people were like, oh, why are you leaving your job? Why are you moving to Paris? So I'd be like, oh, to study public health. And this was in August 2020. So they were like, great timing. Yeah, can you hurry up and get that done? Like, good. We need more of those than ever. But there's that skepticism from more seasoned professionals in the industry of like, yeah, these contracts don't last forever. The money isn't kind of indefinitely there for monitoring and things like that. But yeah, I think in terms of the everyday person who wasn't educated or hasn't worked in this field, understanding a bit more about the aim of public health, the meaning of the words, I think the pandemic has done a lot to kind of grow appreciation for that.
So you got your Bachelors of Science in Anthropology at the University College London. What was the thought process of going into that degree and getting that degree?
Oh, well, the first thing you should know is that I'm more of a emotional decision maker, and I like to go with my passions. And in the UK, we do these things called A levels. So by the time you're graduating high school, you're not kind of graduating with like maths, English, science, blah, blah, blah. You've actually kind of chosen 3 or 4 things to study really intensely. And you kind of become on your way to becoming an expert in those areas. Between like 16 and 18 years old is when you finish. And with my A levels, again, I just chose a mixture of the things that I'm good at and the things I find interesting, because I feel like those 2 things often pair together for me. So it's quite an easy thing. It wasn't like I had to make a big compromise. And I'm lucky that my parents are super relaxed and kind of confident in their kids, and they're happy for us to just kind of find our own path. So I never had that pressure to like become a doctor or an engineer or a lawyer. And so I chose English, and that would be English literature, not language. What else did I do? Classics. So Greek and Roman literature, plays, history, architecture, art and sculpture, things like that, which I loved. And I'd also been learning French for quite a lot of time throughout my school years. And I did a bit of biology, and I was really good at geography. I finished my geography course like 1 year earlier than everyone else. So I kind of just was looking at university prospectuses and was trying to look for something that kind of blended those things together. And it turns out that anthropology exists, and it really does blend those things together. And yeah, it was 4 amazing years that were kind of just on a whim from me, following something that I thought would be really engaging and just really open up new worlds. Like I'd always loved visiting museums and stuff like that. So a lot of anthropologists end up working in museums. which I now know is a very hard industry to get into. But at the time I was like, oh, that could be cool. So yeah, it just seemed like a natural fit for me. And I was lucky to get in. It's a really good course at UCL. And as it is at the French School of Public Health at UCL, the anthropology course is also super broad. And you'll cover medical anthropology, biology. So you'll be looking at like chimpanzees and orangutans and paleo stuff, which is really cool. Basically the development of man, but you'll also do more things that are kind of similar to sociology. So you'll learn how to interview, you'll learn how to make documentaries, and it's a lot of essay writing as well, being able to kind of integrate yourself into a community and summarize it and present it back to someone else. But yeah, it has an interesting colonialist history, particularly at UCL. But yeah, overall, I'm really glad that I did it.
Yeah, and shout out to your parents, especially being from Caribbean backgrounds, not pushing you into being a doctor, lawyer,
I know,
etc.,
right?
engineer.
It's crazy. Maybe they should have. Like, one of my grandfathers was an engineer, and the other one was a lawyer. So it really, I think, I think parenting is very much a reaction to what you experienced as a child, like your parenting style. So I think, yeah, I think my parents maybe kind of wanted to do things differently from how their parents did with them, and so far, we're pretty happy kids. So.
Yeah, working out well. That's for sure. And I always like when people come on to the podcast with like a either sociology or anthropology background, because I think those are like the foundations that public health was kind of built off of, and it's kind of it can be very important and impactful in understanding and applying public health work in just day-to-day life and as a career. I also like literally forgot that the UK has A levels because I'm from Trinidad. We follow it's like a Caribbean British system, so we also have A levels. So I'm very familiar with that.
Okay.
Yeah, I actually left Trinidad right before I was supposed to go into my A levels, so I was never part of that. I didn't get that far into the system, but yeah, like you said, you have those two, like what we think about in the US as grade 11 and 12 is kind of like optional, and you get to dig deeper into the specific topics to really grow your understanding. So very, very familiar with that. So thanks for highlighting that, because I forgot that that's something that happens in the UK as well. During your time in your bachelor's degree, you had an Erasmus year at Sciences Po. I think it was in social science, politics, humanities in Paris, France. So many people, I think, listening to this podcast, the majority of them are based in the US. I don't think we know what an Erasmus year is. So please, firstly, just share what an Erasmus year is and then talk more about that experience.
Sure. So it's this huge scheme. It's basically a European Union student exchange program. So when I signed up, the UK was still within it was the 28th star on the EU flag. It's left since then, so the UK is no longer in it, and they're having to set up their own programs with Australia and other places not in the EU. But essentially, it's a program where you can do education, you can do training, but you can also do more like vocational or extracurricular things like sport, I think, abroad. And the idea is just kind of being facilitated with grants. So you're given money to go and, study or intern, do something in another EU country. And at UCL, I also had the option, and classmates went to outside the EU. For example, one classmate went to Japan, and she actually ended up meeting her now husband there, which is crazy. And some people went to the US as well. So yeah, it's just a term for, study abroad.
Awesome. That makes sense. And I love that there's just that program there that kind of helps with that cultural appreciation, cultural integration, cultural understanding, which I think is something that we miss a lot as an important part of like learning and experiences and just understanding the world from a broad perspective. So talk more about what you did in your Erasmus year, because you said that you moved to France during this time.
Yeah, so I was one of a few people from my school who applied and got into Sciences Po, which is a very old French school, a private school that has a few different campuses around France. I went to Paris, which is like the most well-known one, and it's I'd say it's probably, I think they call it the French Harvard to try and give you an equivalent as people based in North America. I don't know how true that is because I've never been to Harvard either. And it's an interesting place. You can do a lot of courses in French, or you can do a lot in English if you want. I think you can manage to do a whole master's degree without needing to take a class in French. And of course, alongside that, you'll have your like French language lessons to get you up to the standard. Or if you're already at the standard, you can learn another language whilst you're there. So I was there for 2 semesters. And like you were saying about Erasmus being really important, it actually has really impacted like the trajectory of my career and of my personal life as well. I mean, I moved back here because I already had the experience of living here and I really loved it. So it was also great because I was studying anthropology at UCL for 2 years. Then I came to Sciences Po, and the curriculum is super different. It was all like a history of the EU, introductory EU law classes, sociology, things like that. So there's very little. I took one course with the word anthropology in the title, and that was the anthropology of jazz music. And it was like one of the most memorable things I've done in my life. It was a great experience. But yeah, so it really pushed me to dabble in other areas, and it meant that I got to study for a whole extra year for 4 years instead of 3. So it really just changed my life and connected me to so many new ideas and people as well, who I still see to this day. So yeah, if it's a really big privilege to be able to study abroad. And at that time, it was a lot more financially feasible for me because you were given grants and the cost of living went in my favor coming from a different currency. Now, with everything that's going on with the energy crisis, cost of living situation, I leaving the Erasmus scheme, I don't know if it would be as, this golden time that it that it once was. But if there's a way to even spend a semester at another institution, I couldn't recommend it enough.
Yeah, I definitely think it plays an important part in so many people's lives. Like in just understanding that there's more than one way to live. There are so many different cultures out there, and that people just interact differently, and especially in like the public health lens. I see it time and time again in this world. It's like just so important being able to interact with new people who have different perceptions of what health and what's important to health can play in just understanding, as well as like understanding how the systems are set up differently in different places.
Yeah, especially when you're from like the UK is an island that's essentially a declining world power. So it's good to be able to know about, the North American systems and the way different systems in like France and Germany work, because those are dominant. And yeah, I think coming from the UK, it's a weird cultural dynamic where like we used to have a lot of like passport privilege because of our colonial history and things like that. But if you look at kind of the economic reality, we're kind of on a country on decline, and there's a lot of people who would actually like to move away and kind of set up life elsewhere. But to do that, you need a lot of education on how, all the systems work and the cultural norms and the language. So yeah, I feel quite grateful that I was able to start that kind of process a while back, and it's a lot easier for me now in terms of visas and things like this.
Yeah. And outside of like the big takeaway of being part of this Erasmus year program, and apologies for pronouncing the name of the school incorrectly, Sciences Po. I think I said Science Po, but Sciences Po.
Same thing.
It's funny because I took French for maybe like 4 years, but that was quite a long time ago. So did you have any other big undergrad takeaways that you wanted to share?
I feel like a bit tricky to try and give advice or anything, because I just feel like I was really lucky to have the freedom to choose these kind of courses where I would be able to diversify what I was learning so much. And I just feel really appreciative that, when I was first 2 years of anthropology, I wasn't interested in like medicine or politics at all, really. But then I came to Sciences Po and I was forced to take like an environmental policy course, and I was trying so many new things, and having that extra year just allowed me to start connecting all these things that are so inherent in public health, and just allowed me to kind of get it a bit easier. And I realized how political medicine is. So like before I left London, I was like interested in, say, like racial injustice and social and economic disparities, but not so much about like the science of medicine. But then I just take a couple of courses and I'm like, oh, it's all connected and it's so interesting. And yeah, so I guess my takeaway would be take all the opportunities you can to kind of diversify your curriculum, and just look for those new areas to kind of experiment in, and you might kind of be surprised about where that takes you.
Yeah, that diversity in education and experiences, I think, like helps to just, as you said, bring together all those different points and lets you better understand the intersections of these issues, and especially in public health, just realizing how connected they are and like what the policies and systems that are in place around the different systems that we deal with on a day-to-day basis. And after you graduated, I think it is after you graduated at least, you became a behavior change research intern at Hamel. So tell us, how do you come across that and what did you do in that position?
Yeah, so again, UCL, University College London, it's a huge university, and you can study anything from like architecture to medicine there. It's enormous. It's very well funded. So with that comes the perks of having a really nice careers service, people to help you write your CV, people to help you find student jobs, holiday jobs, and then summer internships. So there was just a platform that was essentially working with small and medium enterprises, mostly in London, and advertising, working with them to create like summer roles for UCL students. So it was just an opportunity found quite straightforwardly through my school, and they even helped me to create my application. But yeah, before that, I've kind of always worked. Before in junior university, it was things like retail or behind a bar at festivals and events. So I think, getting as much work experience as you can before you turn up at university is definitely going to give you a boost in kind of professional norms and things like that. But yeah, I definitely make the most of any careers services offered from school.
Very, very important, just to use the resources that you have at your hand. And you were also promoted or shifted into junior account executive at this company. So tell us about that shift, and like, were there any things that changed in the role that you did?
Sure. So yeah, I was taken on as a summer intern, and as I had graduated, I was available. It's a strange story. I had an internship contract for X amount of weeks. And then I signed up for another internship at another company doing communications. I did it for a month. I was really bored, and I felt by the end of the month that I kind of understood what the job was. And everyone was really nice to work. It was a great atmosphere. People were great to work with, but I was just like, oh, I kind of get what this job is, and it seems a bit, I don't know, there was something missing for me intellectually, and I ended up going back to the first company you mentioned, Hamel, which is a behaviour change marketing and communications agency in London. I went back and I had that job. And there I was just kind of doing similar things to what I was doing before, research and being introduced to the concept of account management, client management. So very, administrative tasks, and then also a little bit of research for the different accounts that we were on. So we'd work with pharmaceutical companies. And then they kind of needed some help with their communications and their own kind of visual presence online. They hired me full-time as a junior account exec and social media exec. So on the social media side, I was responsible for planning and implementing the company's kind of internal strategy for their social media, basically promotion and, info sharing on LinkedIn. At the time we were using Twitter and experimenting with Instagram. And then the other half of my job was supporting different teams with their clients. So the main clients were pharmaceutical companies. And we would do things like help them to plan events or presence at big exhibitions, things like that. So, you have to have the kind of furniture with all the branding and make sure that you're promoting the drug in a way that's applicable with local laws. Maybe you're setting up advisory boards on a theme and you need to coordinate flights and accommodation for key opinion leaders, things like that. So yeah, it was a lot of just that basic admin stuff that you need to do to be useful in an office. So yeah, a great transferable skill. And it was really nice working in a small company because you really had a chance to show your own personality and get to know other people as individuals. We were all working in 3 different rooms on one floor. So it was really small, and that with that comes a lot of flexibility. So yeah, anytime you're working in a startup or a small medium business, it means that you've got to be ready to wear a lot of hats and be quite independent and willing to make a change. So yeah, I think that's a good experience to have, to really be able to mix experiences in larger companies, maybe in government offices, but also in startups. They're also different.
And after this role, you moved across to become an account executive at FCB Health Europe, and later on you were promoted into senior account executive. So tell us a little bit about how you come across this role, and then what did you do? Was this a lot of the same work around marketing and things like that?
Sure. So in the field of healthcare marketing and communications, pretty quickly through LinkedIn, you will be introduced to a lot of recruiters. You'll be approached by a lot of recruiters. And of course, you have, as in a lot of industries, you have those awards where they give you or your client awards for, the campaigns that you've been creating, the impact work that you've been doing. So yeah, so it's through industry events and LinkedIn, I would say, that you end up hearing about new opportunities. They kind of just get thrown at you. I guess it's a huge industry, this kind of client management thing. And it's very demanding. Essentially, the model kind of runs on people working on the side of the agency who produces the creative work, working more hours than they're being paid by the client. And then I guess it kind of gets propped up by being part of a huge global group, and somehow the money comes from somewhere. And some projects are a lot less profitable than others, but they're done for social reasons, business reasons that aren't really linked to, receiving the cash right now. So yeah, that's sort of part of my issue with the industry is you do feel like the marketing team on the pharmaceutical side gives you a brief and they don't really know exactly what they're trying to achieve. And so you're kind of working together to get a brief that's kind of backed by science and strategy and aligns with their company's, vision for a product or a service. And then as an accounts person, you're in between the client marketing team and all their bosses and the internal pressures and disagreements that they have. And then you're like the go-between with the strategy team who know the product really well and know the science. And same with the medical writers. But the medical writers also have to work with the creative writers. It's like two different jobs, a lot of different skills. And then maybe you're turning, maybe you're creating a video, maybe you're creating an ad campaign, maybe you're just creating some information leaflets for patients to receive when they're being initiated onto the drug. So it's cool because the work is really diverse, a lot of different mediums. You can be working in print, you can be working in digital, you're creating images and, messages from scratch. But as the account person, you're kind of juggling a lot of balls and trying to keep the project to budget. And you have to keep a lot of different people happy, people with very different motivations and expertise. And yeah, I did find that really hard. But because I suppose I'm quite a naturally organized and conscientious person, it was like a good fit of a job for me to do. I just wasn't super interested in feeling like I felt like the kind of hours I was working late were really unnecessary, especially as such a junior role. I just kind of felt like something is wrong, like I'm not as efficient as I should be, or it didn't really make sense to me. And there are a lot of client decisions that I really questioned. And I just sort of thought, well, I don't really want to work on kind of enriching this marketing person's budget. I really want to be helping patients more directly. But I feel like with my anthropology degree, I don't know enough to do that. So that's why I applied for the master's in 2020.
And that goes right into what I'm about to ask next. But I appreciate you sharing that and just knowing that like being able to work in this field just gives you a better understanding of, okay, this is something that is tough in many fronts and it's not exactly what I want to do. So how can I go about getting to where I want to be and get into the work that I want to do? And thankfully for us on this podcast, it was public health. And before I ask you, so you got your master's of public health at the French School of Public Health. Before I ask you about the thought process, which you kind of explained there already, is when did you learn about public health? Was that something that you learned during your undergrad, or when did that word term field come up for you?
I suppose I've been aware of it as a sort of background thing because my dad had some kind of chronic illnesses. So we are very like health conscious, and I had observed a lot of his experiences with the healthcare system, the costs that would be on his personal time, the limitations on his quality of life, things like that. So I guess I've kind of been conscious. And then with my agency jobs, I mean, all our clients were pharmaceutical companies. So I just always found it more interesting reading about like the rationale of why this product was better than another, or, you know, what's the selling point, what's the cost to the patient, and all that kind of background info and market research. I found it more interesting than like the notion of actually trying to sell the product to a doctor over another. I wanted to not be focusing on selling drugs to doctors, convincing them to pick one thing over another. But I guess because I studied anthropology, right, it kind of makes sense. I would be more interested in the more human side of things. And during these kind of work experiences, I got exposed to, you know, like the behavior change science and things like that. And I think there's a lot of problems with it. Like a lot of it is now being debunked, nudging and things like this. But yeah, I still think behavior change science is a really interesting field. And I just kind of had the feeling of being, you know, like half a project manager, half a go between the marketing and my internal teams. And I wanted to go and just have some more education and a deeper, you know, a more profound knowledge of public health.
Makes sense completely. And then what was the decision? Well, tell us more about the thought process. So you got the Masters of Public Health at the French School of Public Health. Were you being intentional in like choosing to go to France to study public health, or what was the decision behind that?
I did look at courses in London, but it's really much more expensive to study in the UK. And I had such a good time in France. Some of my friends had already moved back to France to do their masters there. And I had that feeling of, you know, envy and homesickness. And my friend Katie came back to visit me in London and we went for drinks. And she was just like, Georgia, just come back to Paris. Just do it. And I'm a very impressionable person and I did it. I just applied to 2 places and they were both in Paris. I applied to Sciences Po because there would be a good chance that, you know, they would let me back in because they let me in before. And they had a policy program and you could have a public health concentration. And I applied to this EHESP, the French School of Public Health, because they had a really diverse program. They seemed super welcoming and it was a really small cohort and it was exclusively in English, but I could also take French classes to help me come back up to that level. So yeah, I applied to 2 places. I was fortunate to get into both. I chose the one I did because as I was still a member of the European Union, my school fees were very, very low, as it was a public university. Sciences Po is private, and I would have had to pay a lot more money out of pocket, and it wasn't super feasible for me. So yeah, I'm very. It's sad I haven't gone back to Sciences Po, but I'm really comfortable with my decision, and you've just got to do it with, you know, what works for your own finances.
Absolutely. And I think that's also something cool to highlight, because even for people in the US or North America that are thinking about getting their masters of public health, a lot of times it is cheaper to go to like France, Germany, Holland to get your degree. And I don't think that's something that people think about, but it definitely is an option, as well as you get that cultural experience, as well as you're able to probably be in classes where you're learning the language and getting more cultural appreciation and just a broader perspective of like what public health looks like just outside of like this UX context for what it is. So that's awesome.
It's something to consider and see if it makes sense for you, for sure.
Okay, so during your MPH program, you had quite a few roles, and we'll go through them. I'll just lay them out, and then you can go through them in your own timeline and tell us about the progression of those roles.
It sounds unhinged.
But it's good to share though. So I'm looking forward to hearing on it. We love to see it. Love to see it. So you were an intern at the World Federation of Public Health Associations. You were a genomics associate at Greater Ormond Street Hospital for Children with the NHS Foundation Trust contract. You were president of the Paris World Health Organization simulation, which you spoke a little bit about earlier on. And you were
Yeah.
also a health equity intern at Broad Street plus COVID-19 data project. So tell us about those positions and a little bit about what you did in them, or like why did you choose to do them, and different things like that.
Sure. So in the interest of efficiency, it's quite a short story for a lot of them. So it was COVID. As I said, I was studying online. A lot of the time we literally weren't allowed to leave the house. And I wasn't working a normal job. So I wasn't working to support myself whilst I was studying. And because my master's course was so broad, I was like, hold on, I don't really know what I'm actually interested in, what I'm leaning towards. I feel like this field is so enormous. I need to get as much experience as possible now that I'm on the track, just to dabble a little bit. So there were a lot of unpaid short-term internships that popped up on LinkedIn during this time. And so I just go for any of them and just kind of go from one to the next. So at the World Federation of Public Health Associations, it was super part-time. I wasn't like turning up at an office in Switzerland doing a 9 to 5. It wasn't like that at all. I was just helping them out online with mostly administrative things, some member surveys, proofreading in English, things like that, like really entry level things, which is great. They constantly have a couple of interns at a time for short periods working on specific projects. So that's a place to check out, and you can work remotely. They're based in Switzerland. So yeah, again, because of COVID, that was another barrier that was lifted for me. I was working part-time and online, so I didn't have to worry about a visa, accommodation, cost of living. So as my master's course was 2 years long, this meant a lot of off time to do part-time internships or work full-time during the summers. So a friend of mine who I met working at Hamel years back, we stayed in touch, and she started working in the kind of genetics department at this really famous hospital in London. Again, another advantage of like living near a major city, you can make it work by commuting long distances to work at these like huge institutions, right? So I worked I think it was just for 2 months over the summer at Great Ormond Street Hospital, which is a children's hospital. And they're really pioneering and have a lot of funding in kind of genomics. And they're doing a lot of testing at the moment, testing of families. And so I was there, again, doing a very like administrative role in the department, essentially setting up a service for the users. I can't really elaborate on it much more than that, but it's essentially an administrative function for patients and their families to benefit from. And during my semesters of the first year of the MPH, I was president of the Paris WHO Association, which is an association that's been going on at our school for about 7 years, I think. And essentially they have an annual simulation of the World Health Assembly. And because I was the very first cohort working during the time of COVID, my team and I had to make the very first online edition. So that was a lot of, logistical differences from previous years. And that was work that we did, after school during our time off. And it was a 2-day event that took place online. And it was a huge success, as we've kind of already discussed. So that project kind of came to an end by a certain point. And also I had the opportunity to help out on this really cool project at this tech company called Broad Street. Again, I saw this on LinkedIn, which seems to be the root of everything. And I was one of literally hundreds of people, actually, who helped to track data on COVID-19 in the US at a county level. So you can imagine, I mean, there's X amount of states and X amount of counties within the states. And what they wanted to do is basically create this database for researchers to use that was kind of a reliable and simple collation of all the COVID-19 numbers, week by week, month by month. And that takes a lot of time and a lot of human power. So yeah, it was a very efficient onboarding process, all completely remote and part-time. I would just be, assigned a couple of lines on a spreadsheet to do. And yeah, we would see which counties in the US were tracking by ethnicity and race. So whether it was, for example, Latino populations, or, was the Hispanic box ticked? And we wanted to see what the numbers were for COVID impacting each of those groups. And that was a really good intro to just working on my data, like input skills, getting to meet loads of other people, and also being able to say that I contributed in one really small way to helping other people out during COVID, which is really cool. Like, starting a master's degree in public health in 2020 is a very strange experience. Like, your own mental health is suffering. You turn up to school and it's all about like epidemiology and how, the way that we're breeding and shipping and eating meat is probably going to contribute to the next pandemic and things like that. So it was a really like heavy time. And I think maybe that's why I looked for all of these distractions, but also it meant that a lot of opportunities came up that did help us to build our public health competencies. So yeah, kind of a blessing and a curse at the same time.
Yeah, and earlier on you spoke about how you realized that there wasn't much talk in your MPH program around climate change as well as mental health. So, and how you kind of like brought that to the front of your work as president of the Paris World Health Organization Association simulation. So talk a little bit more about that.
Yeah, this isn't really I had a really good experience at my school, and the great thing about it is we're such a small cohort in this one course that they really do listen and adapt to the feedback of the students year on year. It's a very flexible organization. So again, another benefit of being in, small organizations, small groups. And I just kind of felt that you might remember the horrible season of Australian wildfires. That was wrapping up just as COVID was kicking off. So we were all kind of learning about the, planetary health and the concept of One Health and the different relationships between like nature, animals, humans, and how like disease and water pollution, like all these things are really interconnected. So it just felt like with everything that was hitting us in the news, which obviously has an effect on your mental health, and you're turning up and you're studying public health, you're like, hold on, shouldn't this be like everything? Shouldn't this be everything we're thinking of? But as we've said, and so many other people on this show have said, public health is so broad. Like, you're not an expert in all of it. There's so many competencies and skills and thematics. Yeah, it's just I guess I discovered that I had this passion about climate change and mental health. So of course I'm going to say, oh, it was nowhere near covered enough in this course.
Yeah, absolutely. I think that makes a lot of sense, and it just makes us realize just how much there isn't being done around certain topics when we do learn about all the broad topics that public health does intersect with.
Yeah.
All right. Well, that's really awesome, and I'm glad that you were able, as a student, to really like understand what is going on and like how you can like make the topics that are of interest and should be of interest, especially climate change, more in the forefront of what we are thinking about as students in the work that you were doing. So, did you have any MPH takeaways that you wanted to share with us?
Yeah, I would say the hardest part is being confident that the course you're applying to is right. And the reason why it's so important that it's right is because it's going to cost you a lot of money. It takes a lot of perseverance. There are definitely times when I was really not sure that I was going to graduate or be able to pass, a certain module. So I would say the advice I got when I was graduating was not to rush into applying for your master's. Go get some work experience. It only benefits your master's application, and it gives you the money that you're really going to need whilst you're studying full time. So yeah, I'm really glad that I had the chance to work full time, learn what I liked, what I didn't like, find a little bit more direction in my life, find kind of a passion to build on. And for some people that just takes longer than others. Like, I'm just not that kind of person who from 7 years old was like, I'm going to be a doctor. And, I just follow what I think is interesting. So sometimes that makes you feel a little bit, lost or a little bit behind. We've just spoken about so many different internships that I did. I think I ended up, by the time I did my internship, that was a requirement to write my thesis, I think I've done like 8 internships. And I was like, this is tragic. This is too much. Like, I should definitely be getting paid by like way more by now. And yeah, I guess I just feel lucky that I had time to graduate, go experiment with working in different roles, save that money, and use it to kind of make a more mature decision about what course I wanted to do, because it takes a lot out of you and you need a lot of support, and you need mental health, physical health, and it's really like a marathon to get through.
Can agree with that more. And I think you became a junior consultant at Philanthropy Advisors right before you graduated, if I'm stating that correctly. And I believe this was this type of like an internship position, maybe not. I don't know. You let me know in a second. But how did you come across this position, and then what did you do in it?
Sure. So again, it's all about the school network. So at the French School of Public Health, to graduate from this course, you needed to write a thesis, and that thesis needed to be based on an aspect of work you were doing at an internship. So you kind of went off and did an internship for a semester specifically. And we had a really lovely Canadian woman who had graduated from my school. She came back and she did a lecture for us about, I believe it was about Sudan. It was fascinating. And she kind of, at the end, introduced what she'd been doing after she finished her MPH. And then, when you're at uni, you just get these emails advertising positions from your school. And I just followed up from there. I found out after the fact that crazy numbers of people are applying for these internships. It's much more competitive than I realized. I think my hiring manager said like around 100 people is normal. And as part of the internship, my title was junior consultant. And again, I was kind of doing similar things I did as an account executive for advertising. It was more just having a research background, working with different types of clients. So these would be like NGOs, whether that would be like family foundations or bigger ones like the WHO Foundation, and kind of helping. We worked on such a multitude of project types, but the kind of expertise of philanthropy advisors is kind of setting up monitoring and evaluation. So I got exposure to that for the first time, which was great. And I also got to work on data, have access to data at the same time as helping the client to complete the project, and write my own thesis, which was on the impact of taxation in the Philippines on habits such as smoking and drinking alcohol. And it was really fascinating as an outsider who had no exposure to, Filipino culture or institutions before.
That sounds fascinating, and shout out to you for being able to get the position that was very competitive and be able to do this work. And I think it just like highlights how you have to put yourself out there, and you never know what will come, and just how those experiences can be so valuable for you, and just better understanding how you can fit into this work. And I think it's also kind of important, like highlighting that you had the anthropology bachelor's degree, and you're like, okay, I kind of want to do something different, but I don't know how to go about it. Then you got this MPH, and now you're able to do like work that is a little bit more aligned, as well as I'm thinking on the climate change side of things, and the climate health side of things was a lot more easily illuminated in the work that you did. Thank you for sharing that. And you are currently a Gen Z advisor for Climate Mental Health Network, and you have been in this position, I think, for maybe almost a year now, since 2022, sometime in there. So, and I believe, like before the interview, you also shared that this was something that kind of came out of the work that you did as president of the Paris World Health Organization Association simulation that happened. So, talk. Well, firstly, I want to say like, that's really important for people to know, that like just being involved in different projects allows you to be someone that is being seen, and allows people to say, oh, this is someone that I would like to be an advisor, or just like share their perspectives on issues, which I think is important, especially the Gen Z perspective, which I think is something that we don't hear about enough, as well as I think like Gen Zs are a lot more woke, quote unquote, or just more aware of issues, and are more, I think, just less afraid of the systems that have been there, and are more like just attacking the systems for just realizing how inequitable they are, or just how unjust they are to many communities. So, saying all that, you're a Gen Z advisor for the Climate Mental Health Network. Talk to us more about what that has meant for you, and more about that experience.
Yeah, so again, LinkedIn. Is this episode sponsored by LinkedIn? Maybe I should be sponsored by LinkedIn.
Right.
I was looking for keynote speakers for the event that I was running, and a woman called Sarah Newman, based in California, got in touch with me actually, and with my team, and was like, hey, I saw you're doing an event about the impact of climate change on mental health. That's so cool. Like, is there anything I can help you with? And we just hopped on a call. And since then, she's kind of helped me find, the keynote speakers for that event. She, after the event ended, she set up an advisory board. There's about 10 of us for her NGO. Tiny, brand new baby NGO that's already having so much impact. So yeah, it was a real like cause and effect, very clear. It was worth the effort of me adding that extra, burden while studying, of doing this extracurricular thing, because now I have this great relationship with the NGO, and even though I'm on a sabbatical right now, I have been given so many cool opportunities. We just work really well together, and I was really honoured to be invited to be one of the first members of the Gen Z advisory board that she set up. And what I kind of do is kind of anything, actually. It's kind of like being a consultant, being a Gen Z brain. And if there's like media requests, if there's like public speaking or, requests to hear a Gen Z perspective on something, Climate Mental Health Network will kind of circulate that opportunity to whoever they think has the best, professional or academic fit to speak on a certain topic in a certain way. One of the recent projects we've worked on that I'm really passionate about is a short film called Gen Z Mental Health Climate Stories. And that was co-produced by Paramount as well as Climate Mental Health Network. And kind of came out of this really cool project called the Hollywood Climate Summit, which is an annual event that brings together storytellers to figure out how we're going to get the film and TV industry to talk about climate change in a way that's productive, entertaining, and feels authentic. So it's a really awesome initiative that your listeners should check out if they're at all interested in like storytelling, the film industry. And Impact is another NGO that was involved in producing this film as well. So Gen Z Mental Health Climate Stories, a bit of a mouthful, was directed by Taya Jennett, and it's a film that has a load of talking heads to kind of lay out the state of play of how young adults feel about climate change, how they're experiencing it, and how they're responding to it. And it's a really emotive film, and it's been really well received so far, which is great because it was built on a really small budget, and it's only 8 minutes long, but it's making a lot of impact and it's starting a lot of conversations. So a lot of what I'm doing at the moment is organizing screenings, going to conferences, things like that. And if any of your listeners are interested, actually, they can go on climatementalhealth.net and they can even organize their own screening for their school or for their workplace. And the film is available with a lot of subtitles in different languages as well, which is thanks to the work of Climate Cardinals, another really cool NGO. So we just want as many people as possible to see the film and to kind of trigger conversations about how we're feeling about climate change and what we can do to kind of get to somewhere productive and a bit happier.
That is very illuminating, and like big shout out to Sarah at the Climate Mental Health Network in realizing that how important it is. Firstly for her reaching out to you and supporting you and getting speakers for the event that you needed, but also realizing just how important it is to have perspectives of Gen Zs in an organization, especially one that has impacts everyone, because many times we view younger people as people that don't have perspectives that are important when that is not the case. And especially nowadays, I think it is very important to have those intergenerational conversations and just have a broad perspective, because as we know, the youth are the one that are going to be living on this planet with all the consequences of the things that the older people have done. So really just being able to advocate and speak from your perspective and be candid in your advising, I think is really important. So that's really cool work that you're able to do there. Just talking on like climate mental health for a bit before we move you on to where you like to see yourself in the future, as well as the Furious Five. What are some key things that you think are important to highlight or to bring to the forefront around climate mental health?
Sure. So for me, the focus is really on first, like, awareness and education. Just I think everyone needs to know that climate change has direct and indirect impacts on our physical and mental health. And those impacts are not equal for everyone. So, for example, so you're based in the US, like communities of color in the US are going to be the ones disproportionately suffering from environmental racism, from lack of tree cover in their street, which means that the concrete is super hot and stresses you out even more. And the hotter you are, there's an association with like an increase in like violence and bad mood and things like that. So I think the first thing to know is that climate change affects all of our health, but in different ways, and different groups have, ultimately it's a question of money that provides a buffer for now. But one thing my like soapbox moment is that I think everyone should be looking at their job as a climate job. And I think it's kind of like a train. It's a trend that you kind of want to hop on early because it's real. It's all a question of adaptation. And every single job, every single environment is going to be impacted by climate change. So knowledge is power, and we all need to kind of educate ourselves about how to live with it, because it's a reality that's impacting us right now, and it's all impacting us in different ways. And then I suppose I just want to briefly mention reparations. I'm a big proponent of climate reparations. So as you mentioned, Gen Z as an age group are the most worried about climate change. And that's for a really simple reason, because they're living long enough to see how it's going to play out in decades and decades, right? But they're also at that age range where they're super well informed. They're getting exposure to these like scary adult issues, and they're also going to school, and they're not seeing this recognition in the content at school. Teachers have like enough problems to be getting on with, and there's research that shows that students are desperate for more climate education, and teachers would like to provide it, but they just don't feel like they have the training and preparation to be able to do that. So there's kind of this knowledge gap in climate science, which I think can kind of be incorporated into any subject. Like we can address the climate in art, we can address it in literature. It shouldn't be, confined to these students who are just studying science. It's something that touches us. It's across the curriculum and all age groups as well. And also we need to then deal with the kind of emotional impacts. And I think generally we have a lot of work to do on mental health. It's underfunded. I think you can make that generalization for much of the world. And working on a good foundation of mental health can only help you deal with negative climate emotions that Gen Z are suffering from, such as eco-anxiety is the big one that we're all focusing on right now. So yeah, I'm really an advocate for, and this is what's great about climatementalhealth.net, is because they're creating all of these resources and providing them for free. You can go on climatementalhealth.net, and if you're a teacher or a parent or just an adult with no kids, there's lots of worksheets and advice and ideas of different things to try to help you better adapt and live with your difficult climate emotions. I think the last thing I want to say is that all the kind of experts who are working on this issue, like psychological associations and things like that, they're all in agreement that things like eco-anxiety are completely normal responses. It's not something that we should pathologize and aim to disappear or medicate away. It's actually a really grounded, irrational response to the changes that we're seeing in the environment and how that's affecting us or our future generations. So I guess the kind of focus for my career now is being an advocate for integrating climate change and mental health education at all levels of the curriculum, and really just kind of enabling people to have these conversations. It's really difficult to talk about mental health, but I think when you see someone else set the example, it gives you a little bit more courage every time to kind of have these conversations with your own circle. But yeah, there's a lot of cultural barriers still to talking about mental health.
And a lot of stigmas, but I like how you eliminate the point of like just around the climate mental health perspective, just how it's important to start with like education and awareness, because many of us probably aren't aware about just how dire it is, but it is important to have the conversations, because that is where we start in having real any kind of like policy or system change. Just working from there is very, very important, as well as I love the point of you saying that there's space for this education and awareness at all stages of our lives and in all different contexts, whether that's art or math class or geography. Like there's different ways to relate it, and it's just getting that information out so that teachers are able and prepared to be able to talk about it and educate people so that we can get those big changes that we do need. So definitely appreciate that work that you're doing there, and I look forward to seeing how all of that unfolds, and let me know if there's anything that I can do to help and support you.
Thank you so much.
Yeah, and I guess with that, you already kind of answered what you like to see yourself do in the future. Taking you back a little bit here, currently you're on sabbatical, as far as I know. So tell us more about why you decided to take a sabbatical and what has that done for you in your career right now?
Sure. So finishing my master's was really tough. And I was writing my thesis during these awful heat waves that we were having in Paris, in a room that was really affected by sunlight, and I just had the most like unproductive, miserable summer. And I really just needed a break. I've always, worked part-time. As we talked about, I was busy in my extracurriculars during the masters. So I really just, I had the money and the opportunity to graduate and then have this year off. I really thought that I'd have more of my life figured out, seeing as it's nearly over, but it's been really good to have this like breathing room to work on aspects in my personal life, to volunteer my time with Climate Mental Health Network, to be able to like travel and go to these cool like events and just kind of have the freedom to explore new topics and fields of study. The main occupation of this time, I did think it would have been working on my French, but I got pretty bored of the French classes really early on, and I got a puppy, and it's been about 7 months since I've had her, and I honestly feel like a full-time stay-at-home mother, and it's very fulfilling. So yeah, it's not easy having a puppy, so it just seemed like a really great timing to do it now whilst I'm not working full time, and I have so much time at home with her to train her, and that's great. And then I've always kind of done a bit of babysitting whilst I'm in uni, so I carried on with that, and I worked with a really lovely family in Paris, teaching their 2 boys English, pick them up from school, give them bath time and snacks and all of that stuff. So very like low stress work, which has been a really nice break for my brain.
Absolutely. And I think that that's important. And I hope that more of us are able to take sabbaticals and just get away and just kind of like just reflect and realize what life can offer and like find more of our purpose and find ways in which to engage with that purpose in work. So I look forward to, well, firstly, I hope that you enjoy the rest of your sabbatical and you're able to get your dog trained and be able to relax and enjoy it for as much as you can, as well as like just get clarity on how you're moving forward. You are most welcome. And then moving you on to the Furious 5, Georgia. 5 questions I ask all guests. Number 1, what advice would you give a student trying to pursue a career in public health?
I would think about, actually, this advice is the same advice I'd give to people who want to get involved in climate activism. I always say just start with what you're good at and what you care about and build out from there. That way, it's the most kind of natural and authentic and sustainable way to approach activism or a career. So if you're naturally, like super into maths and you find data interesting, playing around with data, things like that, then, try and get some experience in epidemiology, choose a course that's, predominantly epidemiology. And as I did, if you're in the position to do so, because I will say that a lot of the internships I encountered were unpaid, just rack up those internship experiences and think about what you can do during your summers off during each year of your university career, and just like go for those big opportunities.
Love it. Number 2, if you're talking to someone wanting to get into your position, I guess maybe as an advisor or someone on a sabbatical, maybe you can answer it from both perspectives.
Yeah.
And hey, doggy, what advice would you give them?
Okay, for a sabbatical, it's easy to have a year go by and be like, wait, what just happened? I suppose for me, what made it sustainable was carrying on working part-time. So you could choose a kind of service industry is really rough, hospitality. I'm not saying it's easy. I'm just saying it uses a different part of your brain to making PowerPoints, researching, writing policy briefs. So I would say, why not look for some part-time work that's just completely different to what you're normally doing, or go back to something that you did in the past. And I think what's paid off for straddling both roles, getting on this advisory board and being on my sabbatical, what's helped me to feel really balanced and still like intellectually stimulated is I'm on LinkedIn every day. I don't know why, because not that much happens to me on there. But I basically, like, I'm trying to say, I try and stay engaged in the world. I haven't like checked out of climate change and mental health. By having this time off, I've been able to like go to Austria for a few days and like be interviewed for Austrian TV, like crazy things that I never would have signed myself up or assumed were possible for me. So it's been a big privilege that's been made possible by being able to work part-time, super flexible hours, and then just saying yes to anything that comes up, and really like joining so many groups on LinkedIn, and joining networks in my area of interest. So all about like being a millennial or a Gen Z in public health, all about being a woman in public health, being a person who's interested in climate change, being a person like just kind of stacking up those connections, and the opportunities really do just kind of fall not in your lap, but you see them on your computer screen if you put the effort into developing your professional presence online.
Yeah, LinkedIn once again. But,
yeah.
But
oh my gosh.
yeah.
Maybe I should work there next. I don't know.
Maybe you should. But that's definitely great insights. Number 3, what's something you're working on improving in your life right now?
I am trying and failing and really inconsistent at meditation, and it's a big tip for dealing with feelings of anxiety, and so it's a shame that I'm not mastering it. I've been experimenting with different forms of meditation, like sound bathing, and I find it really relaxing. It's like playing bowls, and they just sound really beautiful, but I just still can't get quite in the zone of really letting go and being completely relaxed and stopping the thoughts from going too far in my head. So yeah, I think sound bowls are really beautiful. You should check them out. But I just can't quite reach nirvana with them.
Yeah, fair enough. And I know that meditation could happen in many different ways. And I'm someone that tries to practice meditation as well. And I think it's not so much like disappearing, getting the thoughts to disappear, but just being aware of them and kind of detaching from them
Exactly,
is
pushing them
important.
away. Yeah.
Right. But it is I think just being active and just trying to be present in it is something that you would appreciate, and it all happens in your own timing. So don't be discouraged. Just keep on finding ways that work for you.
Okay. Well.
Number 4, professionally, do you recommend anything?
Oh, I wish I had decided on an answer to this before, because I'm a podcast girly and I listen to 1 million podcasts, and yours would be, one of the ones that I'm recommending to someone who wants to learn more about public health. But in terms of something we don't already know about, I recently was a guest on another podcast of this really awesome girl called Heidi Pan, and it's available on YouTube. And it's all about climate change. And so she's interviewing different people in their climate change careers. And it's called 1.5 Degrees. And the amazing thing is, she's a high school student, and she's the most professional one of the most professional people I've ever worked with so far. She was so well prepared. She was such an eloquent interviewer. She really does her research. She talks to such diverse people about climate change, really completely different categories, and yet she talks to them like she's been studying it along with them. And I just want to give Heidi a shout out, because she was a pleasure to speak with, and I wish the best for her very recent podcast, which is called 1.5 Degrees.
Awesome. Well, thank you for sharing that. And as a podcast girly, if there are other things that come to your mind, just feel free to share them by email, and I'll be sure to share those in the show notes for people that want to check it out. And you could also find 1.5 Degrees in the show notes as well. And shout out to Heidi. That's awesome, especially as a high schooler. And then last but not least, Georgia, where can people connect with you?
Wow. LinkedIn, obviously. I think my address is, just / Georgia WT, or you can type in Georgia Welford-Tuitt. I'm sure I'm going to be the only one on there. I'm always super excited and passionate to connect with people who are, if you need any advice from me, or if there's any opportunities you think would be a good fit for me. One of the main projects I'm working on right now is trying to convince the universities I've attended to incorporate more resources on climate change and mental health. For example, if you're studying environmental policy and you're noticing that your cohort is really struggling with feelings of eco-anxiety, what I want to do is kind of get things on the reading list that are, created and vetted by experts, that will kind of just provide that little bit of pastoral support as you're learning the science. And you can also get in touch with me if you want to organize a screening of the short film I mentioned. And if you want me to come and do a Q&A, or, a little workshop, anything. As I said, I'm on sabbatical, so I'm pretty available this summer, and I would love to help. Anything that gets the word out about the impact that climate change is having on our mental health, and just kind of raising awareness of this issue.
Yeah, well, thank you. And I'll be sure to link you. Well, your LinkedIn is going to be linked in the show notes, as well as the podcast descriptions. So people definitely connect with Georgia. Reach out if you have questions, if you're trying to get more involved in that work, because it definitely is a great initiative and great work and needs to be done. So I'm glad that you're able to come on today and share more about your perspectives and your story. And I look forward to seeing just where this career takes you and the work that you're able to do, because I think, as I said many times, it's very important. So appreciate you coming on and sharing so much, Georgia.
Likewise, I think, equally, I haven't emphasized enough how much your podcast has helped me. You're really presenting all of these options and experiences for people to consider. And it's like you're getting mini reviews of schools and companies and countries. And yeah, I think you're doing a great job, and it's helped me a lot. So thank you.
Yeah, well, thank you for those kind words. Greatly appreciate it. Housekeeping items, everyone. Thank you all so much for watching or listening to this. Be sure to subscribe if you have not as yet. Leave a like if you're watching this on YouTube. Leave a 5-star review if you get some value from this, and share this with a friend. Those really help to get the show to more people and just show that the show is valuable. As Georgia said, it is valuable. So be sure to subscribe, review, and share with a friend. Greatly appreciate you all. Peace.